Miss Petunia was playing with her puppy, and they got into an altercation due to her puppy's, how should I say, energetic disposition, excited disposition. Rather quickly, Miss Petunia lost an arm in that altercation. So she is here with us today. Vitals are holding up well. However, based on the emergency, based on the severity, she's already placed under sedation. That is this over here. And I have all of my equipment all placed here. I have her in a nice comfortable blanket for her privacy and just to avoid any shock that comes up from this type of procedure. So with that being said, make sure my gloves are placed. Make sure we have all patient details checked with my coordinator. Miss Petunia is a 1-year-old possum. Very small, very lovely. And after the procedure, I'll give you guys a before and after. So, yeah, let's get started. As you can see, she has a good amount of fluff that has exited the wound here. We're going to stuff that in shortly. Her arm as well is in very good shape. And that will play to our favor as we suture this back together for her. We are not going to place it upside down. We're going to place it correctly like this, and she will look brand new, and I'll place this right here. I placed all of my tools to the left because I am left-handed, and it is easier for me that way. So, we are going to place a gentle hand on her chest like this and push in her stuffing. Very slow. Little by little. We will trim these hairs as well. Not sure if you can see, but I will give a close-up view of the wound here. Also, don't mind her eyes. She's fully asleep. Sometimes patients can present that way, but rest assured she's fully sedated. Here's a close-up of the wound here. As you can see, there are a lot of strands left over. It's about 2 inches. Yeah, 2 inches long, about 1 inch wide, half an inch maybe. We're going to place Miss Petunia on her back momentarily. we'll start by trimming the hairs here. Next, we're going to sterilize. We're going to sterilize the point of contact right here to the point of contact here. So, zooming out, I'm going to get my sterilizer. Right here. I like to place the cotton ball with the scraps right here. Now, as you can see, this thread is very similar to the thread that she has woven into her fur here. Very similar, almost identical. Now, with that in mind, we're going to take a comfortable distance of thread, just like this. Place it through the needle. I'm gonna guesstimate on how much I need. Doesn't have to be precise, but let's see. Okay, that's good. I know this may look rather unprofessional. However, this is how they taught us in medical school. Please bear with me. Very sharp scissors. Okay. The amount is approximately 14 inches of thread, maybe 15. I'll say 14 inches of thread. I doubled it, as you can see here. Now I'm gonna place needle and thread on the table here and knot the end of the thread. And we'll do 3 knots for good luck. So it's going to be a nice and sturdy knot. And now we're going to suture the extremity back onto Miss Petunia. So I'm just taking a look to see how it would fit along here. Connecting the extremity. Looks like. Let me see. So we may run into trouble up here. May have to place a few stitches up along this top part for closure, just because it's a little longer than the arm itself. I think that will be good. So I will start by tucking this piece in here and place the knot on the inside. Just so it won't bother Miss Petunia when she's in post-op. And you can hardly tell where the line is versus the new thread. Okay. So we have that established. And for this procedure, we will do a lovely whip stitch. I believe that's what it's called. I call this so many things in medical school for us. You lose track sometimes. So I'll go with what feels right. I'll say whip stitch. So I'll line it up to here and I'll just go under into the stuffing, making sure it has a proper hold. And that will connect the two. That's done, looking very nice. So now we are going to really make sure that connection is snug. But before we do that, I'm going to move this blanket down a bit. So we're going to do a few more loops here. Just to make sure that first connection is as snug as possible. We are going to test the sturdiness, and I don't feel too comfortable, so I'm going to do 2 more. Again, the family notified me that Miss Petunia's companion is a very big dog, so I'd like to make her sutures as strong as possible. Partly to prevent her from having to come in again, no matter how lovely she may be. Nobody likes coming into the hospital. And we try to avoid what we like to call frequent flyers if we can, especially if it's because of poor work on our parts. And you do that by performing quality maintenance. So, I'm not sure how well you'll be able to see the stitches, but as you can see on her belly here, it's just an indicator on how difficult it could be for her at times at home. So we're going to get her all fixed up here. Now this is going to the inside of the belly, and we're going to bring this thread right back out to the outside here. pretty good. So the stitch that I'm trying to do is a little more stable in the way that it is not straight side by side. And the stitch that I'm trying to do is more of like a ladder. So when you pull there, it'll be a lot more room to do so without breaking the seam right there. So here we connect. Pardon the camera shake, and voila. And right back over. You know what? That is what I did wrong. These stitches will still be efficient regardless. I think I am slightly rusty with my sutures, and that is okay. Practice makes perfect. Miss Petunia will still be in very good shape. So, as you can see, we are making very good progress. Very good. Miss Petunia's vitals are looking wonderful. And we will get her out of here as soon as possible. I'm just gonna zoom out. And now we are on to the opposite side. I am stitching together that area I was talking about earlier above her arm. Just for that perfect sound closure. Miss Petunia is doing beautifully. A few minutes ago, my surgical nurse informed me that Miss Petunia's family wanted us to let her know after the procedure that they are thinking of her. Her companion misses her a bunch and is very sad that she's away right now. So we're going to pass that message along. So now she is on her side, and we will continue with the whip stitch or the ladder stitch. Stitches can be rather tricky sometimes. based on Petunia's small stature, sometimes it's worth it to be slow and cautious and patient. I'm making sure to slowly get under the fascia here. And there we have it. Wonderfully secure. I am doing a tug test here. Very good. I'm going to do 3 extra knots along this area here, right where I started. Just to make sure my final stitch doesn't come out. Gonna pull it tight. the stitches. And I believe that will be perfect. We're going to trim off the excess. And there we go. We're done. Now I'm going to reposition Miss Petunia for her recovery. So, before we get to start waking up Miss Petunia, we just placed her into the recovery position. And as you can see, arms are beautifully symmetrical. Wonderful. And she'll be able to enjoy her life again, coming back home to her family. Okay. Thank you for watching, and I will post before and afters. Thank you for watching.